Welcome to the University of Utah School of Medicine's first ever UteMed program, sponsored by the University of Utah School of Medicine Alumni Association. 2 years ago, the School of Medicine Alumni Association hosted a young alumni roundtable. And one of the suggestions that came from the brainstorming is to do something different instead of the usual continuing medical education conference, and instead to host a program of TED-like talks. This is the result of that. Today we bring together innovative thinkers and doers from our greater University of Utah medical community to share ideas worth spreading and to tell inspiring stories. I'm Diane Magipinto. You may know me from 90.1 KUER, the morning edition host there. Not used to seeing anybody, so it's nice to see you here, and thanks so much for allowing us the use of this beautiful auditorium. We're going to move quickly through our program so that we can end promptly at 5 o'clock. Please silence your cell phones. If you do need to leave the auditorium and come and go as you will, please be courteous. The restrooms are through the back doors, as well as refreshments. Today we have a mix of students, physicians, and community leaders joining us. And again, we thank the Skaggs College of Pharmacy for allowing us the use of their newly renovated auditorium. It is beautiful. This program is being streamed live by the generosity of Utah Education and Telehealth Network, UETN, around the state of Utah, and right now into Alumni Hall in the Eccles Health Sciences Education Building. Albert Einstein said, "The important thing is not to stop questioning. Curiosity has its own reason for existence. The only true source of knowledge is experience." Thank you for joining us as we listen to our speakers share their knowledge and experience. Our first speaker is Dr. Vivian Lee. Since July of 2011, Dr. Lee has served as Senior Vice President for Health Sciences, Dean of the University School of Medicine, and CEO of University of Utah Healthcare. She is responsible for an annual budget of $3.2 billion, including a healthcare system of 4 hospitals, numerous clinical and research specialty centers, including the Huntsman Cancer Institute, and the John Moran Eye Center. A network of 12 neighborhood health centers, an insurance plan, over 1,300 board-certified physicians, and the schools of medicine, nursing, pharmacy, health, and dentistry. A graduate of Harvard-Radcliffe, Dr. Lee received a doctorate in medical engineering at Oxford University as a Rhodes Scholar and her MD from Harvard. Following a residency in Diagnostic Radiology at Duke, she trained as a fellow in MRI at NYU. She has been recognized nationally for her influence and innovative thinking surrounding changes occurring in healthcare systems. Today, she will share her experiences working to be a leader to the leaders in transforming healthcare. Please welcome Dr. Vivian Lee.
Thank you so much. Thank you. Thanks so much, Diane, and thank you all for joining us today. I want to make a special shout out to Kristen Anderson and Jackie Holland and the whole team for trying out this new format. And I'm really looking forward to the day when I get onto the Delta Airlines flight and I see us as part of the Delta Entertainment channels. I think TED-Med, UteMed go together very nicely. So I'm going to talk today about leading the leaders. And what I mean by that is we are looking at a time of intense need for transformation in healthcare. And what we need are leaders. We need leadership. And I believe that the part that's really missing in our national discourse is the engagement of our physician leaders. That we need to enable our physicians to step up and lead this transformation. And a lot of what we're trying to do here at the University of Utah is a reflection of our success so far in leading the leaders. So our story starts about 3 years ago when one of our general surgeons, Courtney Scaife, was suggested by her friend. She said, "Courtney, why don't you Google yourself?" So Courtney said, okay. She went and Googled herself, and the top hit when she did that was a website called vitals.com. Vitals.com is a physician review website. I don't know if any of you have seen that before. And on Courtney's website, there were 3 reviews, 3 rather unflattering reviews. And here's one that I thought I would just share with you that was pretty typical of these 3. Says, "I would not recommend this surgeon. She is only concerned with money and her title, has no compassion or feeling for her cancer patients. My vet has more compassion." Ouch. Now the thing with Dr. Safe was she knew, although she's not perfect, she knew that actually patients thought much more positively about her than these comments reflected. And the reason she knew that was because we've been collecting patient satisfaction data since 2008 and feeding it back to all of our providers. And so she had hundreds of patient responses. They weren't all perfect or all flattering, but on the whole, they were much more positive than this. So for example, let's look at a few of those kinds of comments that she typically gets. So Dr. Scaife was wonderful. She made me feel at ease. All who participated in my visit couldn't have been more hospitable. There's one review that's a little bit maybe more iffy. It says, "She asked me to follow up, and I was too startled to ask why, as the surgery showed no sign of cancer." But this would be kind of the typical kinds of responses that she got. And so Dr. Scaife, being a rather competitive woman, said, "We have so many comments, so much real patient data. Why don't we just post all our patient satisfaction scores online and post all of our patient reviews online and go head to head and compete against these sites like vitals.com, Healthy Grades, and these other commercial sites? Because at least with our data, we know that these are real patients. Only real patients get these surveys and complete the questionnaires to post. Whereas on these other websites, it can be a neighbor that's mad at you. It can be an ex-boyfriend or spouse or who knows what. Those aren't valid data sets." So we listened to Dr. Scaife. We had a little bit of an internal discussion about it for a few months. And then we went ahead and listened to her, followed her advice, and started posting all of our patient satisfaction scores with all the responses online. And we learned a lot through that process. We learned a lot, probably a lot of lessons that Healthy Grades and Vitals could benefit from about how to actually engage our physicians and how to tap into their intrinsic motivation to do good and to improve. A lot of those thinkings are captured very nicely in this book called Drive by Daniel Pink. And many of you may be familiar with his work or with this book. It's an excellent book. What Daniel Pink tries to talk about is how we can tap into people's intrinsic sense of motivation and drive, especially necessary when we need to tackle large, complex problems. And healthcare is really a large, complex problem. And what he says is that if we're able to tap into people's intrinsic sense of drive and motivation, we're going to get the best outcomes and the best solutions. And he talks about it in the construct of 3 particular points that we need to think about. And they are purpose, autonomy, and mastery. And if we can tap into each of those, we're going to be able to engage people in a way that extrinsic motivators, like money or like recognition, may not be as successful doing. So I want to talk a little bit about each of those points and talk about them in the context of engaging leaders like leaders in healthcare. So the first theme is around purpose. That in order to be intrinsically motivated and really engaged, we have to have a profound, deep sense of purpose about what it is we're doing. I think this is relatively straightforward because most physicians come into healthcare with a very strong sense of purpose. We come into healthcare wanting to help people, wanting to cure people, wanting to alleviate suffering. It would be wonderful if we could extend that definition of our purpose to trying to fix our healthcare system and improve our delivery system. And I think most people also start to feel that way about their own purpose as well. So purpose is relatively straightforward. Now let's talk a little bit about autonomy. This is very important to most physicians. Physicians don't want to be told what to do. They want to have the autonomous ability to decide and act. of their own accord. In order to do so, it's very important for physicians to have good data. Physicians generally are pretty data-oriented, just like the patient satisfaction data. Other data about quality, about access, about costs. Data are very important. One of the challenges with data that we have is that most physicians will immediately have the reaction, well, the data aren't perfect. The data aren't perfect. My patients are sicker. My patients are more complicated. It's not really fair to compare me with someone else. So it's very important to engage physicians in the way in which we collect data and in the quality assurance, the verification of the validity of the data, which is something that we learned a lot about in the patient satisfaction journey and which we're also doing now in the quality and cost journey as well. Once you provide the data, the next step sometimes is to enable the physicians to act on that data, perhaps with a few extra tips, maybe a little bit of extra guidance, maybe some extra training on patient communication in the case of patient satisfaction, or around, say, process improvement or lean management when we're looking at operations and quality. But generally speaking, what we want to do is give the physicians the data and give them the chance to respond to that in their own way and to come up with their own solutions and to have that autonomy. That is very, very important. And I think that's missing in our national discourse when all too often we as physicians are being told what to do. And that's not working. That's really not working. The third element of tapping into intrinsic motivation and drive is my favorite, which is mastery. And I think all of us who have gone into healthcare and who have survived our years of being pre-meds and then being medical students and then being residents and then maybe even being fellows, we are people who really derive a lot of satisfaction from mastering things. We mastered anatomy, we mastered physiology, we mastered, say, surgery or procedures or clinical diagnosis. And even beyond just mastering, I think we also are people who are intrinsically gratified when we outmaster other people. I have a line, once a pre-med, always a pre-med. I guess I can say that. And so when we give physicians some data, we give them the ability to improve themselves, maybe provide a little extra training when it's necessary. And then we give them the satisfaction of mastering the material, mastering the new fields, the new directions that we want to go in, and maybe even tap into some of that competitive tendency of many physicians to allow them to even outmaster others. Those are some of the critical elements I think are at the basis for a lot of our success in tapping into that intrinsic motivation, intrinsic drive to improve. So I'll give you an example or a story I think that really reflects this, and it takes us back to Courtney Scaife, our general surgeon, and Courtney is in the Department of Surgery in the general surgery department, and she is led by two wonderful individuals, Sam Finlayson, who is the chair of surgery, and Rob Glasgow, who is the vice chair of surgery and responsible for clinical quality and operations. And both of these guys, I think, really understand what it means to tap into intrinsic motivation, and they really understand how to lead leaders. After all, they've been leading a whole bunch of surgeons for the last several years. So a few weeks ago, Sam caught me in the hallway, and he whipped out his iPad, and he said, Vivian, check out our quality results for the department in laparoscopic surgery. He is a laparoscopic surgeon. And he said, I'm so proud. Look at our quality measures across all our surgeons, which we measure with our value-driven outcomes tool. And he said, we are consistently outperforming. We're consistently having great outcomes, very low rate of complications, low rate of readmissions, short lengths of stay. I said, that is fantastic, Sam. How about costs? How are we doing on our costs? Well, at the University of Utah, with our value-driven outcomes tool, we actually truly do measure costs, not the charges, but the actual costs of care. And so we have data for every one of our providers for example, for all the procedures that they do, what it costs us for that provider to provide that care. And we have it broken down into things like facility utilization, how long are they in the hospital, how long are they in the operating room, the supplies they use, the pharmacy, the imaging, so that they can compare themselves. And then we color code it a little bit, and you can get a sense of whether you're spending more or less than all of your peers in the department, for example. So when Sam pulled up his iPad on the cost side for laparoscopic cholecystectomy, this is sort of what it looked like. And this in particular was just the subset of data on the costs in the operating room. So the surgeons asked for just a small snapshot of data of their total costs, looking at operating room costs. In fact, I think Dr. Langone might be one of these bars here somewhere. I'm not sure. So here we have the average costs in the operating room for all of the surgeons doing laparoscopic cholecystectomy. And I said, well, that's pretty good, except that there's so much variability. Where do you stand, Sam? And he said, well, this is Rob, and this is me. So I said, Sam, that's pretty good. You're number 2. Not bad. And Sam said, I know. He said, I have been using this, this balloon dilator for my laparoscopic operations. And I trained with this balloon dilator, and Rob and the other guys have been telling me, I don't really need it, but I trained on it. But they now tell me that they're going to help me learn how not to have to use it because none of them use it. And in fact, it adds considerable costs. It's this little pink box. And so when I stop using that dilator, I'm pretty sure my quality is going to be just as good because they all do the procedure perfectly well without it. But now I'm going to be the lowest cost with equally good outcomes, so I'm going to be the highest value surgeon. Great, Sam. Good job. So then, walked down the hall, happened to run into Rob. I said, Rob, I hear Sam is about to drop that dilator. He knew exactly what I meant. And he said, yes, Vivian, I know. And it's important for our chair to feel like he's the leader, and that's wonderful. But what I'm going to do is I'm going to go back and work with all the other surgeons, and we're going to try to get everyone's costs down. Really try to get that variability down so that we can be the highest value department in the country. And that way we can all be winners. This, I think, is a reflection of what we can do when we tap into people's intrinsic sense of purpose, give them the data, allow them the chance to think about what potential solutions might be, maybe ask for new data, maybe ask for it to be presented in different ways, maybe give them some extra tools, but then allow them to work on mastering it and maybe even out-mastering the information. And with that, we are able to allow our physicians to do what I believe that they are best trained to do, which is to lead. And with that, I thank you very much for your attention. Thank you.